From CBC Podcasts and the Fifth Estate, Brainwashed is a multi-part investigation into the CIA's experiments in mind control. From the Cold War and MK Ultra to the so-called War on Terror, we learn about a psychiatrist who used his patients as human guinea pigs and what happens when the military and medicine collide. Listen to Brainwashed on the CBC Listen app or wherever you get your podcasts.
This is a CBC podcast.
Well, it's a little late, nearly June, but it could yet be back to the classroom for students in Ontario. After another school year full of interruptions, there was this week some last-minute momentum to get kids a bit of actual face time with their teachers.
Schools should be the last to close and the first to open. Our schools were safe before we closed down in the rapid rise of the third wave. Now, most of the medical officers' health in the province of Ontario, including those in the GTA, feel that they are pretty well ready to move on that as soon as possible because they understand the need for students to be back in for many reasons and the value of in-class attendance in there.
That's Ontario's top doctor, David Williams. And for some parents, that idea feels like a lifeline. This is Layla Cannon O'Hearn.
We're concerned about her mental health, and I don't even know how to put it into words. Like, just having a couple weeks in school would just be such a lift and a boost. She's generally a pretty happy kid, but I have seen changes in her just in that she's, that term languishing, like lately when I go, hey, how about we go ride a bike? She'll be lying on the couch and she'll just say, I don't want to go. Like, my body just feels tired of this. And it really it hurts me to hear it because I can see that she's struggling.
Still, the threat of COVID has not gone away, and that is leaving some parents feeling like it's an impossible choice. This is Shannon O'Brien.
It just rolls around in my brain constantly of what's the right thing to do. And it's not necessarily the safest thing. It's not necessarily the best thing. It's not necessarily the obvious thing. And it's really, really hard. The numbers last year were lower and the schools were closed. This year it's like, meh, fine. And so I don't think confidence is something I'm going to feel anytime soon. I might feel relieved because our children are basically feral at this point. I work a full-time job. My husband works a full-time job. And having two small active children out of the house for a bit while they're at school makes me definitely feel relieved. But if they're in these unsafe, overcrowded, poorly ventilated school buildings for the next few weeks, I don't know how I feel about that.
Dr. Michelle Ward is a pediatrician at the Children's Hospital of Eastern Ontario and part of a group of physicians calling for a return to in-person learning. Doctor, good morning.
Thanks for having me.
Thanks for being here. Why should students return to class now?
I think you've just heard it from the two parents that spoke. Kids need it and parents need it too. Parents need it because they need to be doing well in order to parent their kids well. And we know that parents are really struggling. But kids need it because they really thrive on routine and structure and those connections that they have with their friends, with their teachers, with the other adults that support them at school. So it's school is the only universal experience and intervention we have. So it's the one thing that we can offer to all kids.
What we heard from one of those parents, though, Shannon, is real conflict over whether having her children in school is the safe decision. What would you say to reassure a parent like Shannon?
Yeah, I think these are fair concerns, and we really need to weigh all of the different pieces of information. But what we know is the risk with COVID in schools is really related to community spread. So before the schools closed in Ottawa, where I am, 86% of school cases were acquired in the community. They're not acquired in the school. So I think safety for kids and the staff in the school is really important. But it's not good enough to say we're worried about safety. We're not putting those things in place. We're just going to keep kids out. We've looked at other sectors to how to keep people safe, and we need to do that. And I concur with Dr. Williams that it really should be last to close, first to open, because the schools are not the drivers of transmission.
Let me go back to the risk thing in a moment. What have you seen in terms of health impacts on kids during the pandemic? I think all of us parents anecdotally have our own stories, but as a pediatrician, what are you seeing?
Yeah, it's really tough. It's tough times for everyone, and it's especially tough for kids and youth. So where I work, for example, we've seen 3 times the number of emergency department visits for eating disorders this school year as compared to last school year. On a more national level, advocates like Children's Healthcare Canada are reporting that admissions for suicide attempts have doubled over the course of the pandemic. And we had heard early on, and it continues to be the case, that kids are reaching out for help twice as often to places like Kids Help Phone. So anxiety, suicidality, eating disorders, all of these things are way off the charts as compared to where they were before.
And so when you take a look at getting kids back into the classroom, how much of this is about the educational experience? I mean, actual learning, and how much of it is about relationship building, about routine, about, not having feral kids?
Yeah, I think it's a great question. And, I'm not an educator, and so I would never speak for educators. I can only speak from a health perspective and as a parent of 3 kids. And what I would say is that we want kids to learn. We want kids to maximize their education. But if you're not well, you can't do that. So if we take a step back and look at what's going on, kids are not doing well. Some are doing okay. Many are not okay, and some are doing really poorly. So if we can at least raise the bar on that to help kids develop some of those connections again, some of the routines and structures, that will also play out in terms of their learning. But I think at this point, it's getting kids back to school so that they can be well, they can reestablish those structures, and that the school system can grapple with how is this going to work and plan for September so it can be even better in September.
I mean, the other issue is that the school year is almost done. Maybe 4 weeks, depending on where you happen to be. So there are people who are saying this is just going to be more disruption, not just on students, but on families, on teachers. Again, what would you say to those who are worried about further disruption? To say just ride this out, and we'll deal with September when September comes.
I think it's a fair concern. And, I've thought about that a lot too. And I have younger kids who are in the primary and middle school system and one who's in high school, and it will impact them very differently. But what I would say is that kids live in the today, and days are important. Moments are important for those kids, and particularly kids who are not doing well. I think adults might be able to relate. When you're not doing well, often it's one moment when you've connected with somebody or had a positive experience that can help turn things around. And so we need to give those opportunities to kids to have those connections, to have those moments. And I can tell you, my kids are really looking forward to going back to school, 2 of them more than one of the others. And I'm not saying it's the right decision for every family or every child, but I do think we need to offer that opportunity, particularly for those who don't have access to other things that are keeping them healthy, like, access to other services or being able to get outside into a healthy environment, or parents that have the time and ability and means to be able to support them during this time. So that's not the experience for everybody. We need to provide that opportunity for every kid.
The reality is that COVID hasn't gone away, though, and this is across the country. I mean, you take a look at Ontario, the provincial modelling shows that a return to in-person learning could result in as much as an 11% increase in COVID cases in the province. So why is that worth the risk, given everything you've just said?
I think those are risks that need to be weighed at a different level than an individual pediatrician's level. What I can speak to is that we know that there's risks with opening all kinds of different things. And we're hearing plans and we're being told metrics for how we can open in other sectors, recreational sectors, business sectors. What we haven't been told is what are those numbers there? And why is it that we're still having this conversation about safety in schools without a clearly laid out plan as to how do we get them back? And they were back before. And we did show that the rate of spread in schools was very low. And we do have a better ability now to track cases. So I do think that we've made a lot of headway in that way, and that we have to remember that it's the community spread that's the issue. It's not really the school spread that's the issue. So when we weigh those, I hope that is what weighs into people's decision making.
How concerned are you about the long-term impacts of this disruption? And again, in many parts of the country, it's been a bit of a yo-yo. Kids in class, out of class, in class, out of class. How worried are you about the long-term impacts of that?
I'm worried. The kids that did okay, and are doing okay will continue to do okay and will bounce back. The kids that were not doing well before the pandemic are really not doing well, and they're going to need so much support. And then there's this middle group that would have otherwise been fine and are not doing fine now. And I think that's what we're seeing in terms of higher rates of all of these mental health issues. So I am worried because those don't turn around in the matter of 2 or 3 weeks. And so we also need to be investing in not just prevention, which is getting them back into routines and structure and connection and those kinds of things, but how are we going to manage what some people are calling the fourth wave of mental health disorders?
You mentioned your own family. In addition to being a pediatrician, you're also a mom and 3 kids. 2 of them are interested in going back to school, 1 perhaps less so. How are your kids doing, if you don't mind me asking?
You know, my kids are fortunate, right? They have parents who are not struggling to keep jobs. We live in a comfortable home. They can get outside. They have bikes. And so I think this is what people have to remember is even though it's been difficult for them, and there have definitely been moments where my kids melt down and just say they cannot do it any longer. I sat on the bench on the corner of my street just last week with one of my kids who just had a moment of, I can't do it anymore. And I think everyone has had that experience. But I fully recognize that my kids have a lot of advantages. And I think this is why it's so important to look at universal applications of what we can do for kids like school, because many kids do not have those advantages, and they're the ones that are going to hurt the most.
Can I ask what you said to your kid who said he couldn't, or that they couldn't do it anymore?
Yeah, I said what I always say. I, said, buddy, I hear you. I feel the same way, right? Tell me about it, and let's get through this together. And that's how we deal with all the issues. And, it's a learning moment, and it's hard as a parent because you can see how hard it is for them. But these are our opportunities to teach them how we can get through these things together.
Dr. Ward, thank you very much. I really appreciate talking to you.
Thank you.
Dr. Michelle Ward, pediatrician at the Children's Hospital of Eastern Ontario in Ottawa.
I'm Nala Ayed, host of Ideas. In this age of clickbait and online shouting, Ideas is a meeting ground for people who want to deepen their understanding of the world. Join me as we crack open a concept to see how it plays out over place and time and how it matters today. From the rise of authoritarianism to the history of cult movies, no idea is off limits. Ideas is on the CBC Listen app or wherever you find your podcasts.
Well, doctors and parents can only look on nervously, while teachers and school staff are the ones who may again be expected to show up to school every day. Laurie French is the president of the Canadian School Boards Association and a school trustee with the Limestone District School Board in Ontario. Laurie, good morning to you.
Good morning.
If the government in Ontario decides to get back to in-class learning as soon as perhaps even next week, how ready will schools actually be?
Well, I think schools are going to be very ready. The ability to respond to the changes that we've seen over the last year and beyond have been incredible and have placed immense burden on our school system. At the same time, returning to school is our usual, and that's where our expertise lies. So I would say that schools will be very ready to welcome students back.
Why do you think that some provinces have been able to keep kids in the classroom for all or most of this year, but others, like Ontario, have not?
I think it's really a local decision. The value of a school board is that across the country, we are the eyes and the ears on the different communities and what's happening, and working in collaboration with our public health experts to make decisions. And, we have to listen to our families, we have to listen to our educators, and we have to listen to our health experts, and then make a decision. And that does look different across the country.
Do you believe that education has been prioritized? We've been talking about, the roadmaps for other parts of reopening in the province, but has education truly been prioritized, not just in words, but in deeds?
I would say yes. Once again, we're relying on the education system to provide so much as far as teaching beyond academics and public safety in how they manage. And, to the comments that were made earlier about our schools being safe places, we have access to PPE. We have access to people who understand infection control practices, and they're doing an amazing job of keeping spread very, very low. In schools. It is a community spread situation. So, we once again will look to our schools to provide not only a healthy place, but also to support that academic return and all of the mental health and socialization that goes with that. That's so critical right now.
What other steps need to be taken to ensure that schools are actually safe places? I mean, there are many groups, many of them who represent teachers, who say that there needs to be, for example, better ventilation in schools before kids are back in class. How necessary is that?
Well, I think it's something we all have to look at. The reality is that schools are aging infrastructure across the country, and that's no different in Ontario. So, of course, are investments required? Absolutely. But that's not new to the current environment. That said, we know that school boards are looking very carefully at the resources they have and putting supports in place to respond when there are concerns. I would say, though, again, that our schools are safe places, and so understanding how we work within the spaces we have, understanding distancing, understanding, maximizing outside use of space, those are all considerations to really ensure that safety continues. And over the long term, we do have work to do in schools, for sure.
What's your sense, given that, how comfortable teachers are about being back in the classroom?
Well, our teachers have been amazing experts over the last while, and I have such immense confidence and faith in them. That said, we do know that there's a real division, right? Our educators are also parents, so they're struggling with children being at home through all of this as well and trying to do their very best for their students. And so considering all of that, we do see that there are some educators who very much want to be back in the classroom, and there are those who would prefer to continue with remote learning. And, that's something that we need to do as leaders, support them, understand what's happening, and continue to advocate for resources in the classroom.
Do you think teachers should be prioritized for vaccination before any return to in-class learning?
That's a tough one for me because my background is healthcare as well in my day job outside of my education role. And so, I have great faith as well in our public health system to be prioritizing that. There are ethical components and there's a real prioritization that's required based on need and risk. Does that mean that we need to consider individual communities? Absolutely. I think that in some locations, educators and school staff do need to be prioritized, but I would not say that that's the case across the country. We can't make one decision that applies to all and expect that it will work the same. Each community is unique, and I think we have to really consider that as each school board, and each public health region considers these decisions.
What about the province of Ontario? And again, it's not just teachers, it's educational assistants, it's school staff. If we're asking them to be back in the school, in the classroom, while COVID continues to spread in the community, and I get numbers are down, but it's still there, should they not be prioritized?
I think they need to be prioritized in the hierarchy of risk, like everyone else in the essential worker group. Our schools are essential services, and so we need to consider that relative to who else is at risk and where we are in the progression of availability of vaccines.
Is it worth it for the 4 weeks that remain in the school year, do you think, to have students back in the classroom if, as I mentioned earlier, there could be an uptake in COVID cases in the community? That's shown from modeling from doctors that advise the Ontario government. The risk of increasing cases, I don't know that we can necessarily attribute that directly to return to school. We know that spread of COVID has predominantly been community spread, not in schools.
But I would say that the value of every day in a school is worth it. We need to, of course, have all of the safety measures in place, ensure that people have the information they need to go forward carefully. But every day in school is a benefit to our students, particularly having been out of school for so long.
What about, again, just briefly, the idea of being creative in terms of how we think about this? This isn't possible everywhere, but not having kids actually in a classroom, but maybe learning outside, maybe figuring out ways that kids can be together without being in, as you say, those aging buildings.
And I would say that our educators have been maximizing that throughout the year. We're coming out of winter, of course, so where that was more difficult, but now is a perfect time for us to utilize those outdoor spaces. In some situations, we have to remember that the conditions for that are not exactly the same. Downtown Toronto, it's a little more difficult to do that than in more rural areas. So we can't, again, assume that strategy will work for all students, but absolutely it's a great component of safe return to school.
Just in the remaining 30 seconds or so that we have, how worried are you that we'll be having this conversation again when it comes to the return to school in the fall?
I think that question is going to remain as much as we are coming out of this, certainly after Wave 3. We have to proceed carefully, and I don't believe for a moment that by the end of summer this will be gone from our minds. So, of course, that those conversations need to continue. But at that time, we'll assess the situation and make decisions based on what we know then, and do what's best for the kids.
Laurie French, good to speak with you. Thank you very much.
Thank you so much.
Laurie French, President of the Canadian School Boards Association. Parents, students, teachers, educators, we'd love to hear from you. You can email us at thecurrent@cbc.ca.
For more CBC podcasts, go to cbc.ca/podcasts.